right, welcome back. I'm Michael Stamatinos, your host for the Advancing Healthcare Innovation Show. And if you're new to us, we're crazy passionate about healthcare innovation and adoption. And our aim is around bringing real stories from real leaders that are innovating within our space. And truly, we've had an action-packed year. If you hadn't had an opportunity to check out some of the new content we've placed, go back, hit subscribe where you are now. We'd love to hear your thoughts on it. And today, I'm just ecstatic to have a very senior leader here in the healthcare space, Stuart Hanson, the CEO of Avaneer Health. Stuart, welcome to the show.
Thanks, Michael. Good to be here. Thanks a lot.
Awesome, not a problem. So I kind of just want to dive into it. Your background is pretty fascinating, and you've spent a good portion of your career in being in really highly regulated environments, and now being at the helm of Avaneer. I just kind of wanted to maybe dig in a little bit about what excited you most about the Avaneer vision and now you being at the helm of it. So let's start there.
Sure. Yeah, no, thanks. First of all, I do want you to pass on to my kids someday how fascinating you find my career, my background. Because they think I'm like super ultra boring and can barely keep up with their latest TikTok speak. But no, so sorry. So what I'm excited about within the opportunity that we're tackling at Avenir is just the real change that can bring, that a network can bring to the healthcare industry. And you mentioned a little bit about my background in highly regulated industries. So as you know well, Michael, I've spent the last 20 years at the intersection of financial services and healthcare, which are two of the most, if not the two most regulated industries in the country. And working at the intersection of PHI, protected health information, people's individual health records, et cetera, and their financial information, both of which consumers are extreme and should be extremely sensitive to, has been a really interesting intersection for me. I first fell in love with the healthcare space because of the complexity and the opportunity to create value in the way information is moved around payments in the healthcare space, and to try to simplify consumer payment experiences. What I'm excited about at Avaneer is really doubling down on that, and taking what has been learned at the intersection of healthcare and financial services and really applying that broadly, both to the administrative use cases in healthcare, some of which are payments related, some of which are not, but giving the same consumer experience on the end in terms of what consumers have come to expect from banking, where you can use an ATM or a debit card anywhere in the world in most cases to access dollars and get them in whatever the local currency is in real time. Translating that experience to moving clinical records, moving care information, moving claims, administrative transactions to try to improve the patient experience and the costs, and to really drive down some of those barriers in healthcare. The way we've driven them down in the financial services industry is really what's exciting to me.
Fantastic. So I know that being in some of those highly regulated environments, innovating within them, it's hard to get people on the same page, on the same agenda. And it's interesting that Avaneer, with your early investors that also happen to be customers, can you talk about that relationship between someone that's an investor and a customer, and how do you kind of tread that fine line as you're trying to deliver solutions to real problems that they're encountering?
Yeah, I think so. Probably the biggest piece of that answer is that seeing real change in any of these really highly regulated industries where information needs to be so securely cared for really takes scale, right? You can't solve banking information globally without a significant industry investment in infrastructure, right? It started with the ATM debit networks. Those were used to connect bank account DDA deposit systems. And on a global basis, eventually those networks converged to support the ability for you to use an ATM card in Hong Kong and withdraw local currency from your US dollar bank account in the United States or the UK. So I think what the scale that takes in terms of the infrastructure behind it and the security that's required and expected behind that, just being table stakes for the solutions, is really what's unique about Avaneer. So when you talk about what we call our founding members, which is an impressive group of payers, providers, technology company partner and a bank to really get this to scale is why this is the go that's worth going at, because so many good ideas, so many great ideas, even government funded ideas only go so far because there's real barriers to adoption. So, our founding member group, which is HCSC, Anthem, CVS Health, Cleveland Clinic, Centara Healthcare, IBM, Watson Health, now Meritive, and PNC Bank. Those are the organizations that collectively those payers represent 80 million covered lives, so almost a third of the covered lives in the U.S. And getting something like what we're building at Avenir, and we can talk about that in a few minutes, to the scale that it needs to get to be secure and be trusted and to be impactful in the healthcare landscape is really what it takes to get this off the ground.
Yeah, so it sounds like you're saying in order to innovate, to get the impact that you want, you got to start out with a sizable scale, even just to start out with. So you can't just kind of snowball this small. You're saying you got to go big or go bigger to start.
I think so. And I think the other piece of what you just said kind of prompted me back to one of the things I was thinking about at the beginning of your question, which is in order to innovate, innovative companies need some level of infrastructure to be able to innovate upon to get to scale. Like I can't tell you how many really super cool innovative products, solutions, whether from the banking side or from within the healthcare or revenue cycle side or clinical insight side or care intervention side. All of those companies need to get access to data, right, to be able to operate and to be able to deploy whatever their special sauce or their use case is to create value for consumers or physicians or hospitals, et cetera. And so many of those companies have had great ideas, great capabilities, but have not been able to get to scale to get the data that they need or to push the data back out into the systems that they need it into to deliver on their promise. And they often, fail before they get over the hump of, any kind of scale in terms of delivering their value. And that's the other super exciting part about what we're building at Avenir, is we're building not only a network for connecting payers and providers directly, but to give innovative companies, whether they're in the industry or outside of the industry, even banks or purely technology companies or revenue cycle solutions, a platform to plug into to get their solutions to scale and to revenue and to deployment much more quickly, which allows them to focus their investments on really the innovative part of what they're doing, as opposed to wiring systems together in a different way for a specific use case.
It's curious because you have some of the big EMR players that are out there, and the question kind of is around, well, who actually owns the data? In this instance, like, who owns this data? Is it sort of a coalition, a collaborative amongst the founding partners of this? I'm just curious how that works and how you can leverage that.
You've stumbled into a great question. The way the platform and the network are being built, the data stays in the resident systems where it exists today, right? We're just a new secure data highway for that data fluidity across the ecosystem, across the industry. So we're not trying to wade into who owns the data, right? Whether a patient owns this piece of data or the clinician owns some insight that they added to it, or the EHR company or the payer. It's kind of irrelevant for us. We're just trying to break down the barriers or tear down the silos that are restricting that data from being used the way it needs to be used in real time.
Interesting. So you mentioned about how you guys are a super highway. So let's talk about Avenir in itself. So what is Avenir? What isn't it? I know that you recently did another interview and you were pretty clear about what it isn't. Maybe you can kind of reinforce some of those comments in a previous interview in this one.
Yeah, I think one of the hardest things for most people to immediately grasp when they hear a little bit about Avenir is what we're not. So I'll start there. We're not a traditional data aggregation model. We're not a business that sits in the middle of payers and providers and software companies and kind of brokering who has access to what data, or manipulating the formats of the data so that it's ingestible by the right systems, or de-identifying data or aggregating. Like, there's a lot of really cool solutions and tons of amazing companies in those spaces, including all kinds of companies that add value to the data as it flows between parties. We're simply infrastructure, right? So we're not aggregating data. Like no one is downloading all their data to Avaneer to do something with, to then spit out to other participants. We sit in the middle and operate a network much like a cellular carrier or a dial tone operator in the old wired telephone days. We're just enabling the endpoints to know where to get data so that we can tear down the barriers that prevent it from moving fluidly. That includes EHR companies, right? There's a lot of great EHR initiatives specifically to enable data to move, from one version of their software in one geography to another potentially, or to a payer, or between a payer and a provider. But there's no real common infrastructure layer for participants to move data, regardless of what EHR, or regardless of what backend system, regardless of what claims adjudication platform they're on. And that's what we're building.
Pretty fantastic. And, the key term interoperability has been thrown out for about a decade now. And it's nice to see that you guys are doing it in a nuanced way where you can actually get real impact. The last 2 years have been really interesting. The world has changed quite a bit. And I don't think there's ever been a better time to be innovating within healthcare. And that means that, opportunistic companies continue to pop up. What have been some interesting surprises that you've had on this journey so far that you think are worth sharing?
Well, I think what we saw in the last 2 years on the positive side, right? A lot of negative things have happened in the medical community with COVID. Now, another outbreak of monkeypox. I think during COVID, and I'll say healthcare, I'll set the healthcare system or industry aside for a second. What you saw were organizations who'd been developing 12 to 18-month roadmaps for being able to support their employees being remote. And all of that got condensed and accelerated into weeks or days of time, right, when COVID lockdowns hit. And what was really encouraging to me was how quickly we saw technology could adapt, right, to a real need for something to happen a different way. And I think in the healthcare industry, what you mentioned, we've all heard about interoperability for at least a decade. I think in 2013, I was invited to a healthcare, an HIE roundtable at HIMSS when I think I was at Citibank at the time. And I got invited into that, and everyone around the room kind of talked about what they were doing and how they were thinking about their HIE or interfacing with an HIE. And none of them talked about any financial flows. None of them talked about any business models. And I didn't get booed out of the room, but I did get a lot of really curious stares when I started asking questions about solving some of the administrative use cases and what the business case was for changing the way the data flowed. And I got a lot of blank stares, a lot of scratching of heads, and a lot of people were wondering how I stumbled into the wrong room. But that was when HIEs were just starting to get talked about, and interoperability was still in its infancy, and things were just getting funded at a state level to enable relatively small geographies to try to interoperate, right, and to try to move data fluidly between their systems, regardless of EHR, et cetera. What we've seen now is so many health systems are now multi-state, so many payers are, in multi-geographies, multiple regions across the US. That model of interoperability really never delivered on the full promise of what consumer expectations were then, let alone what consumer expectations are now, post-COVID, when now they all do televisits. Now they all do, 80% of their work meetings from their home office in a lot of cases. So I think back to your main question, the really exciting thing is just how quickly technology can enable change when there's broad recognition that it's needed. We got excited and are still excited at Avenir about the broad recognition of the companies that we talked about, and expanding that now that we're ready and we're launching a production version of our network, expanding that to other payers and providers, first on a geography basis, and then obviously beyond that.
When you think about the maturity scale of where people are on innovation, do you find that your founding partners are a little bit farther ahead, meaning you don't have to go so far back to get them up to a point where they can actually excel leveraging the Avenir network? and what do you foresee in the future as you maybe talk to other providers, other payers? What happens if they're not as far along on the maturity model in terms of how they're innovating? How do you kind of close that gap? I think that's just something that I'm seeing now, is where you see innovative companies that are coming out that are doing things that are so far ahead that oftentimes their prospective customers feel as if though that is just so far into the future that they can't really fathom using it. Have you
Yeah.
have you run up against something like that? I'm just sort of curious how you've uh, how you've positioned Avenir to really kind of overcome some of those challenges.
I'd say with our founding members that I talked about before, it took a lot of real thought leading industry thought leading motivation on their parts to come together to form what has become Avenir. But I won't say that's uncommon, right? There's a lot of innovation always trying to happen, right, in the industry. But I think there's like an industry level innovator's dilemma, right, within healthcare, because not only is there so much complexity, so much regulation, but also there's been so much. I'm going to use maybe a provocative term, a lot of technology debt acquired across the industry, trying to adapt old systems, old processes, old industry standards for data transformation and data conveyance to new problems, and to try to solve new problems or old problems in a new way. And I think that regardless of how innovative a company is or isn't, it's still difficult to re-engineer or reimagine processes, especially back office processes, to be able to take advantage of some of the new capabilities. The exciting point that I talked about before is once there's a recognition, right, and a proof point, we've learned that technology can enable really rapid transformation. I don't remember the quote, but we always underestimate, how much transformation is going to happen in the next 3 years, but we always overestimate how different things are going to be in 10, which tells you that, the industry in general, innovation tends to go in really rapid cycles once the technology is ready for the enablement, and once you hit some proof points. So the way we're positioning Avenir is leveraging the 80 million covered lives and the industry participants that we've had from our leaning in founding members to expand that and to really articulate a clear value proposition, because just with that handful of companies, we've got a line of sight to solving $300 to $500 million worth of cost for those companies with a new way to move data between their organizations. The proof points of that, I think, will create really rapid adoption for a broader group of industry participants that we're looking to connect with now.
I think what you've said there is really compelling, especially if there's any other startup founders, executives that are listening in on this. Is people are really quick to talk about innovation, and sometimes where I feel like they miss out on is building the business case. And you've mentioned it a few different times, and now you've actually put an actual number as, hey, this problem, it's much bigger than what you actually think it is, and it's this. How much of that do you think has influenced your founding partners to really motivate them to move? I mean, do you feel like that's a huge piece of the story? Because as much as people say that they want to innovate, is it really boiled down to how much are we saving them? How much are we making them? And preferably you're doing both of those. I guess I just want to see how, underlining that, like, is that really?
It's a very strong reinforcer in the case of our founding members, right? Because innovation can, like ideation or great ideas, can only take you so far. At some point, you get to a CFO's office, right? And he's like, wait, how much are we spending on that idea? And what are we going to get for it, right? And I think the industry has been scratching their heads with a bunch of investments in, new back-end systems across the healthcare landscape. And they're like, wait a second, I thought that was going to change the billing experience for my patients, or I thought that was going to allow us to move data more freely between different health systems. And I thought that was going to help us to intervene and manage care more quickly, and we were going to save something and improve people's lives. So the rubber always meets the road when it comes down to tangible benefit. So we're definitely seeing each one of our founding members at a different point in their journey of recognizing oh, we thought we'd start down this path because it'd be really cool and would make things a lot easier. And we thought it would create a lot of value. But now that we're seeing this specific use case quantified across, you know, 3 different large payers and 2 different health systems, like, holy crap, like we need to double down on this. Pardon the French. Holy cramoly, we need to double down on this, right? So we're definitely seeing that as a big reinforcer for that group. But in terms of other industry participants, other health systems, other large insurers, being able to see a real tangible value of doing business differently and putting aside the fact that a lot of them compete or coopetition amongst each other, being able to recognize that these use cases around data silos are not controversial, right? They're not where they differentiate their business. Healthcare providers differentiate their business on the quality of the care that they provide, right? And the quality of the physicians that they hire, and the quality of the nursing teams and the facilities that they invest in. They don't compete on things like eligibility and prior authorization and workflow and back office automation, right? Payers, likewise, they compete based on the brands that they're able to build and the relationships they're able to establish with members and with employers and amongst each other. So casting all of that stuff aside and just focusing, how can we deliver on our value proposition as an enterprise more efficiently with our trading partners? Then they can start to recognize, we really should all use one infrastructure, all use one fire version, right, for moving data back and forth between organizations. We really shouldn't, limit or make it more difficult to access data for some of our clients. So those are the things that are getting exciting to us as we start to make it real with the platform we're building out.
So let's your job is to peek into the future, right? So let's just play a little scenario. You and I are sitting down again a year from now, and we're looking back. What needs to happen in order for you to feel satisfied, as the captain of this ship? What would you be really excited about if we're sitting down a year from now and looking back?
That's another good question. I think a year from now, we hope to be live with a number of different use cases around some of these administrative cost savings and really showing examples of tearing down the barriers between these industry participants and enabling data fluidity. So I think if we are looking forward to late next year, multiple use cases with really solid business value propositions, ROIs behind them live, and some geographic density around some of the big payers that we have on our platform, as well as some buy-in from other large payers that can help drive some of this value into their markets with their provider group. That would be a strong measure of success for me for 12 months from now.
Very exciting. So tell us, how can we follow your work? I would say that there's 2 styles of companies that you see. You see there's certain companies that they broadcast everything that they're doing, whether it's making a strategic hire and you're seeing press releases. It just seems as though Avenir has been very strategic about some of the things that you guys are putting out. Is that because you're just in the trenches, really focused on executing and solving a real problem and getting after it? Just
Yep.
sort of curious where your train of thought is there.
Yeah, we'd love to come back on your podcast. I follow it very avidly. But it's not strategic. We're not trying to hide what we're doing in the industry. We're really trying to laser focus on making sure we deliver instant value for the early adopters and the investors that we've already got on board. As we start to go live with some of the capabilities, we're going to want to start to talk much more openly to encourage more interest, because this is a network business. So any network effect, right? Every endpoint creates more value for the other endpoints on the network. So we want to scale this as quickly as we can. But we want to go out and have those discussions grounded in the reality of delivering on a specific value proposition for the payers and providers that brought this whole thing to life. So I think you're going to see us become a lot more vocal and be a lot more involved in podcasts like yours over the next 12 months as we start to make it real.
Well, great. Well, as a community, it's all about helping one another, especially when it comes to advancing society at large. For me, I'm very passionate around access and leadership, and those things combined. There's no better place to do it than innovating within healthcare. as a community, how can we best support you? How can we help Avaneer Health?
It's a good question. I think one of the things we haven't talked about one of the things is um, just how human some of what we're building can be, right? So we talk about, I'm thinking back to early days of COVID and seeing videos of patients waiting in an emergency room in New York for their medical records to be printed and CD-ROMs to be burned, to be sent in an ambulance with them while they moved into a hospital that had more ventilator capacity. Like literally people having trouble breathing, waiting for a download of their medical records. We think about, a personal example, I had to receive an emergency eye procedure about a year ago. And as I was sitting in the office, one of the gentlemen at the front desk was, advocating for his elderly father who had not been able to confirm eligibility for this same relatively emergent eye procedure to avoid a retinal detachment. And he had been back 3 days before that. So he was back in the office waiting to see if they had verified eligibility. And so the human component of what we're trying to build at Avenir is really kind of lost. Sometimes when we just talk about we're building a platform, we're building a network, data interoperability, bits and bytes and fire servers and blah, blah, blah. The reality is we're trying to solve really important human problems, which is what healthcare is all about, right? Forget about revenue cycle management and all the other things. Like we're trying to actually care for people who need medical assistance and need data to flow very fluidly to be able to enable that. So I think that's something we didn't touch on that I think is important that comes through, especially as we start to gear up for more and more discussions with you, Michael, as we go through this journey. But I think what can the community do was your question. I think trying to reinforce within the community what the value is of collaboration is really important to what we're building. I talked a little bit about kind of forgetting about the fact that these organizations compete in different markets or, have proprietary rights to some of the data, or at least they think they do in some of the patient records that they build. Forgetting about all of that, the ultimate goal is to provide better care, and data is a really important part of doing that. So I think maybe if I could ask for some help from you, from your audience, from other podcasters and other industry thought leaders like you out there, it's to really promote this idea of collaborating to solve for the greater good of healthcare. It's a $4 trillion industry. It's big enough for all of these companies to make money doing what they do best, providing great care, providing great patient or member experiences, et cetera. The $1 billion of that's spent on administrative activities, and a lot of that being waste. We're targeting a quarter of that billion, or did I say billion? $1 trillion, right? Yeah. Is spent on the administration. We're targeting the low-hanging fruit of the 250 billion of that we think can really be solved by a data interoperability platform and network. That's going to take collaboration across the industry, and it needs to be broader than the awesome group of founding members we've got. So promoting that message, I think, would be super helpful to us.
Yeah, innovation and collaboration go hand in hand. It's hard to change without changing, and I think it's more or less around the mindset of it's not us versus someone else. It's like, hey, if we can find common ground, which I hope everyone can, which is we're human beings here. We're trying to help one another. We're really trying to be mindful about this. Then let's start there and let's build off of that. So yeah, Stuart, this has been great. And for those that have been just sort of tuning in, if you found this content helpful for you, would you mind sharing it on social media? Would you mind commenting on it or liking it? Just resharing it with your network. These things are really helpful. And I'm just so grateful when conversations like this make a difference, when they actually can advance healthcare forward, and bringing innovators and doers together in a community. And that's something that I've always dreamt of, which is, hey, let's build an authentic community where people can actually do something together. The money stuff takes care of itself, as outlandish as some people might think that sounds, but it always has in my life. It always has. So Yeah, thank you, Stuart, for just being able to come on, and we're looking forward to our next conversation. Fast
I'll
forward
look
a
forward to it
few,
as well.
cool. All right, take care and be well.
Thanks a lot, Mike.